Hello, I am Dr. Maria Marasich. I'm the host of Let's Talk Menopause Summit. People have been asking me why I'm not doing a presentation, and I wasn't intending to since I'm the host. However, at everybody's request, I have decided that it would be useful for you to hear some information from me. I want to share with you what really happens physiologically during the menopause process. So it is menopause madness. When estrogen levels drop, all hell breaks loose, unless you do some of the things that I'm going to talk about here. So these are some of the more common symptoms that all of us are familiar with menopause, hot flashes being probably number one, weight gain, fatigue, depression, so on and so forth. None of these probably surprise you, but I have a question for you. Which of these symptoms is related only to hormones? Well, I'll tell you. It's the urinary problems and the vaginal dryness. All those other symptoms have a brain component. And this is the most overlooked factor of menopause, is what happens in the brain as estrogen levels drop. Obviously, there's things happening in the brain when we see things like foggy brain and anxiety and depression as major concerns. Here is an article that appeared in the New York Times stating symptoms like night sweats, hot flashes, and depression originate not in the ovaries, but largely in the brain. And if you look down here at the bottom, it says by 2020, twice as many women as men will have Alzheimer's. Now, this is a serious concern because the changes that happen in a woman's brain during menopause puts her at much greater risk for not only Alzheimer's, but a number of other issues. And so now is the time to start working on this, to keep your brain healthy as well as all your other tissues. We think of menopause as a hormonal event, right? Well, that's not the whole story. It is actually a neuro-endocrine-immune process. Neuro for brain, endocrine for the hormonal system, and that's not just sex hormones, it's all hormones, and the immune system. Now, who would have thought the immune system plays such a big role? So here are the three things that I feel must be addressed. And if we do this, it's not menopause madness. It's what it should be, which is all of us sailing through menopause with ease. So we need to address the cells, i.e. neurons, and make sure that they're unpolluted. We need adrenals to be strong. This is your stress gland. And we need minimal inflammatory triggers occurring within the entire body. A little bit about me. I am a lifelong resident of Sun Valley, Idaho, born and raised here. And as you can see, I was North American champion, and I did race in the 1984 Olympics in the downhill event. My curiosity about health and wellness began as an athlete, of course, aspiring to be my best self, physically, emotionally, and mentally. And so I've carried that forward into my career, and I practice something called functional medicine. Functional medicine looks to find the underlying problems rather than just treating the symptoms. So in our little iceberg here, the medical profession typically looks at what's on the surface and names that, first of all, and then treats it with drugs or surgery. My job is to look for all the underlying things, the things that may not be so obvious under the surface, and to try and balance that. And the story is very true with menopause as well. In the case of menopause, women's health for that matter, if a woman is premenopausal and she's having hormonal type symptoms, the typical medical advice is birth control pills, which is basically hormones. And if she is perimenopausal or menopausal, then the advice is hormone replacement, which certainly can help to a certain degree. But in my opinion, it really misses the boat. So perimenopause and menopause can be a long process. For most women, it starts around the age of 40 and carries on through to the age of 60. The average age of menopause, and menopause we define as having no period for 12 months. So the average age of menopause is 51. What happens first is progesterone will decline. And this can happen, usually early 40s, but it can even happen in earlier than that. And we'll see changes in the monthly cycle. Periods may become heavier. We might start to see some emotional challenges like anxiety and depression and sleep issues. Sleep issues commonly begin here. Then, as estrogen declines, the problems become bigger and other problems appear or escalate. In fact, I call menopause the great magnifier, because any little subtle imbalance that's been happening in the body suddenly is magnified when the estrogen levels decline. And we need healthy adrenals to provide the backup, no matter where you are in this process. So if you're premenopausal, then having healthy adrenals is going to help balance all the hormones, as you'll see in just a moment. And those unhealthy adrenals will cause hormone surges and an immune response. So here we're going to have a little lesson on hormones. Your body actually uses cholesterol to make pregnenolone. Pregnenolone is made in the adrenal glands mainly. And then pregnenolone has two choices. It can go down this left pathway and become progesterone and then cortisol, which is the main adrenal hormone or stress hormone that many of you are familiar with, or it goes down this right pathway to make all the sex hormones. So hopefully we have a balance of those two. But for most of us, we have something called pregnenolone steal, meaning the pregnenolone shifts and goes to the cortisol, the stress hormone, and not so much to the sex hormones. And that can cause some serious imbalances for premenopausal women. But as women go into menopause, it really wreaks havoc with the system if this is occurring. So the adrenals have to take over and produce any hormones that your body would be producing once the ovaries start to decline or stop producing. And that means the adrenals are activated. We could say if the adrenals are weak and they get activated due to the menopause process, we will see imbalances in blood sugar regulation, which can lead to changes in mood, energy, and weight gain. It also will directly affect your sleep. So if you're having trouble falling asleep, or you wake up in the middle of the night, which is quite common, and you can't go back to sleep, that is an adrenal imbalance. It causes surges of cortisol, which cause us to put on weight, especially around the middle. Also, every time you get a cortisol stress response, it actually damages brain tissue, and it further imbalances the immune system. It also affects all the other hormones in the body. Dr. Lissa Rankin wrote a fabulous book called Mind Over Medicine. I highly recommend it. She's got a couple other books, but she really makes the point of the fact that 90% of doctors' visits are the result of stress, and that we really aren't addressing that. And as long as the body is stuck in a stress response, it cannot heal. However, your body is brilliantly equipped with natural self-repair mechanisms. They only function when the stress response is turned off. So number one, we have to turn the stress response off. And it's the stress that we all have accumulated over our entire lifetimes that are playing a role with the adrenal function. So it's not just the stress you're going through today, it's the stress of your entire lifetime and how that's accumulated in your body. So all this stress accumulated will leave us with unhealthy and weak adrenal glands. And when that happens, we get what I refer to as hormone surges. So bursts of hormones, and then they drop. And with those hormone surges, we get hot flashes. So that's what's behind the hot flashes. But also, every time that happens, And along with the estrogen decline, we also get something called cytokine surges. Cytokines are messengers within the immune system. So they say, hey, immune system, do your job, kick up, come on, let's go. So we get these cytokine surges, and that is going to trigger an immune response. Now, what does this all mean? It means that we are prone to inflammation within the body. So when estrogen levels drop, we are much more prone to inflammation, and this is the problem. That systemic inflammation can cause all these symptoms that you see here on the screen. Can increase the likelihood for cancer, for cardiovascular disease, Alzheimer's, diabetes, arthritis, autoimmune, neurological diseases, and pulmonary diseases. Which, of course, puts a woman at greater risk for these diseases. And it's clearly shown in the studies that a woman after the age of 60, her health typically declines much more radically than a man's. And it's because of this sudden increase of inflammation, which is linked with all of these diseases. Also, osteoporosis starts at this point due to that inflammation. So what do you think is the most important thing to address during menopause or perimenopause? I think it's inflammation. So let me explain this a little bit further. That cytokine surge, cytokines again are the messengers that tell the immune system to activate. When we get those cytokine surges, it activates something called microglia, which are the immune cells within the brain. And when that happens, we get a reduction of the neurotransmitters. Guess what the result of that would be? Poor moods, poor energy, and poor sleep. It also turns the fat cells into fat factories. So they make their own hormones and proliferate. So we get an increase, obviously, in weight for many people. We get a loss of bone, which can release toxins because some toxins, heavy metals in particular, are stored in the bones. So we get an increase in toxicity in the body. It activates something called reactive oxygen species, also known as free radicals. And free radicals, you may have heard, cause cell damage and cancer. Also, altered prostaglandin means even further immune imbalance. And pain. When we have increased inflammation, we have increased pain. How many of you have been experiencing knee pain, back pain, shoulder pain, neck pain, any kind of pain, head pain? All of that can increase with this immune activation. At the same time, the limbic system, which is the main emotional area of the brain, becomes imbalanced and actually overactivated. So we'll see an increase in irritability, we'll have a short fuse, we'll feel volatile. And that has a big role, the limbic system, on the autonomic nervous system, which is the part of your nerve system that works without you thinking about it, like digestion. So we'll see sudden gut problems. And with sudden gut problems, we can see a decrease in mineral absorption, and that's going to affect the bones, of course, and hair, and further inflammation. It also further messes with the blood sugar imbalances, which again can mess with the weight gain, energy, and moods. The autonomic nervous system also affects neurotransmitters and the hippocampus. The hippocampus is the area of your brain where you store memory. So the hippocampal function decreases. And blood pressure often goes up. So you may have had low blood pressure for lots of your life, and now suddenly you have elevated blood sugar or blood pressure. So it leaves us all feeling like, due to the influence of hormones, I could burst into tears or kill you in the next 5 minutes. How many of you felt like that? Stay away from me. Okay, so once again, here are some of the more common symptoms, and I'll tell you, there's at least 50 different symptoms that are associated with perimenopause and menopause. So if you're having any kind of random symptom that you don't understand, it could very well be menopausal related. But I just want to remind you that the only ones on this slide that are related to hormones alone are urinary problems and vaginal dryness. The rest of them have a brain component and an inflammation component. And as long as you overlook that, health could be declining. Okay, that's not to say that hormone replacement therapy can't be beneficial, but it's not addressing the whole picture. So my restoration program is, number one, reduce the stress response. And we have some very special techniques that we help people do that. Number two, we have to ungunk the cells. And remember, the cells get gunked just by being alive. You know, we ungunk our houses, we clean our houses weekly, hopefully, or somebody else does. And we change the oil in our cars and such, but most of us have never ungunked our cells, and particularly the neurons in the brain. We need the cells ungunked in order to respond to hormones appropriately, and in order to produce energy and to produce happy chemicals, so the happy neurotransmitters. Excuse me. And thirdly, we must stop the inflammation. So I have a total body reset to stop the inflammation. We have to look at things like food sensitivities, pathogens, toxins, anything that's happening within the body that can be triggering that immune response and therefore causing inflammation with the body. And like I said, hormone replacement therapy can be beneficial. I do my restoration process with people, whether they're considering hormone replacement or not. So here it is in short view. We want to reduce the stress response. We want to stop anything that's triggering inflammation with the body, and we need those cells high functioning. And if we have that, our brain jumps for joy. And so do we. All right, so normally in my office, I do a whole health exam that costs $350. And with this summit, I'm offering that at a discounted price, not $350, but $199. And this is available whether you live locally or not. If you live locally, I want you to come into the office because you'll get some benefits. But even if you don't live locally, we can do this via telemedicine. And what would be included in that consultation and exam is video conference on Zoom or in person, either way, computerized neurocognitive testing. This is a test that's very valuable just to see just how well your brain is functioning. And the really cool thing about it is that we get to retest afterwards and see the improvements. We also do a neurotoxic assessment. If you are not able to come into the office, we can do that virtually with a $15 extra fee. We do a metabolic assessment looking at organs, hormones, blood sugar. We will review any blood work that you have had done in the past. And I look at blood work differently than most doctors because, again, I'm a functional medicine practitioner, and we look for patterns and other clues as to the underlying health problems, not just naming and treating diseases. If you're in office, we'll do an EEG, an electroencephalogram, to determine just how well your brain is functioning in terms of stress. And again, that can be redone later to see improvements. We'll do a complete neuro and organ assessment. That would be in office as well. And in either case, whether you're in office or via Zoom, we can order any additional lab work that might be necessary. So we might want to look at further hormones. We might want to look at adrenal glands. We might want to look at gut function, things like that. So again, symptoms like night sweats, hot flashes, and depression originate not in the ovaries, but largely in the brain. I am a brain specialist. That's my passion. And because of that, I have become a menopause specialist, because this is a huge time that things change in a woman's brain. So I hope this has been beneficial for you to understand a little bit more of the underlying mechanisms that are happening within your body and your brain during this process. I hope you've enjoyed the summit. I do want to give a call out to the Sun Valley Wellness Festival. They are one of our sponsors, along with my clinic. The Sun Valley Wellness Festival will be happening in June, and we have fabulous speakers. You got to check out their website, sunvalleywellness.org. I hope you can join us for that. And then thirdly, anybody who would like to purchase the summit for just $39, that $39 will go to benefit the advocates of the Wood River Valley. So all proceeds go to the advocates. All right. Great. Thank you again. Please let us know if you have any questions. I'm happy to answer any questions regarding my presentation or any symptoms that you may be having. And I hope that you sail through menopause, which to me means that your next 10 or 20 years are going to be healthy and happy as well.